What if I told you that one of the most powerful foods for improving insulin sensitivity, reducing the chronic inflammation that drives diabetes, and even stimulating the regeneration of the very pancreatic cells that produce insulin, is something most people with diabetes have been told to feel guilty about eating? I receive some version of the same question every single week in my practice. Doctor, can I ever eat chocolate again? And my answer consistently surprises people. Not because the answer is no, because the answer is that it depends entirely on which chocolate. And that distinction, which takes about 30 seconds to identify on any grocery store label, changes everything. There's a type of chocolate with a glycemic index of 22, less than a third of white bread's glycemic index, with compounds documented in peer-reviewed clinical studies as capable of improving insulin sensitivity, reducing the inflammatory markers that feed insulin resistance, and stimulating the regeneration of pancreatic beta cells. That chocolate exists. It is on the shelf of your local grocery store right now. And the person with diabetes who does not know the difference is either living with unnecessary guilt over something that could actually help them, or eating the wrong type without understanding why their numbers are not responding the way they hoped. My name is Dr. Kenji Sato. I am a preventive medicine physician and longevity researcher with decades of clinical practice working with patients managing type 2 diabetes and prediabetes. Today, I'm going to show you 5 specific types of chocolate that the evidence supports for people managing blood sugar, the exact mechanism by which each one affects glucose metabolism, the clinical studies behind those effects, and the specific label traps the food industry uses that most consumers never catch. If you find this kind of precise mechanism-based information useful, subscribe now. Every week I cover one topic completely, the science behind it, and the practical protocol. It costs nothing, and it is the only way this platform will continue showing you this content. Before we get to the 5 types, you need to understand what makes cacao fundamentally different from every other sweet food in existence. Because without this foundation, the 5 types will seem arbitrary. With it, they will make complete biochemical sense. Cacao contains a concentrated class of polyphenolic compounds called flavonoids, specifically catechins and epicatechins. These compounds have 3 documented mechanisms in human studies that are directly relevant to blood sugar management. First is improved insulin sensitivity through endothelial function. Cacao flavonoids improve the health and responsiveness of blood vessel walls, which improves the ability of cells throughout the body to receive insulin signal and take up glucose from the bloodstream. Insulin resistance is fundamentally a problem of impaired cellular communication. The insulin is present, the glucose is present, but the signal is not being received efficiently. Cacao flavonoids help restore that signaling capacity at the vascular level. The second mechanism is reduction of oxidative stress. Cacao is one of the foods with the highest antioxidant capacity measured in the scientific literature. Oxidative stress is one of the central mechanisms of insulin resistance. When cells are under oxidative stress, their insulin receptors become less functional, and the downstream signaling cascade that drives glucose uptake becomes impaired. Reducing oxidative stress is not a cosmetic benefit. It is a direct intervention in the core mechanism of insulin resistance. The third mechanism is the most remarkable and the most directly relevant to people with type 2 diabetes. Epicatechin, the most abundant flavonoid in cacao, has been shown in human cell studies to stimulate insulin secretion and promote the regeneration of pancreatic beta cells. These are the cells in the islets of Langerhans that produce insulin, and they are progressively damaged and destroyed by the chronic hyperglycemia and oxidative stress of type 2 diabetes. The possibility that a dietary compound could support the regeneration of these cells, rather than simply compensating for their loss, represents a fundamentally different approach to the disease. The critical point is this: these benefits reside in the cacao, not in the industrially processed milk chocolate bar filled with sugar, hydrogenated vegetable fat, and minimal actual cacao content. The difference between the product that delivers these compounds and the product that does not is visible on any grocery store label in under 30 seconds, if you know what to look for. Let us go through the 5 types. The first is dark chocolate with at least 70% cacao content. This is the most accessible entry point for someone with diabetes who wants to include chocolate in their routine without compromising blood sugar control. The glycemic index of 70% dark chocolate is approximately 22. For context, white sugar has a glycemic index of 65. White bread sits at approximately 71. A glycemic index of 22 places 70% dark chocolate in the very low glycemic impact category, producing a slow and gradual blood sugar elevation rather than the rapid spike associated with conventional chocolate. The mechanism behind this low glycemic index is straightforward. With 70% cacao, the product contains substantially less sugar than conventional chocolate. The remaining composition is primarily cacao fat and cacao fiber, both of which slow digestion and moderate glucose absorption. The fiber content delays gastric emptying. The fat content further slows the rate at which any glucose present reaches the intestinal absorptive surface. The Harvard T.H. Chen School of Public Health has documented that flavonoid-rich foods can improve insulin sensitivity. Research published in the American Journal of Clinical Nutrition has shown that regular cacao consumption may reduce cardiovascular disease risk, which is specifically relevant for people with diabetes who already carry significantly elevated cardiovascular risk as a consequence of their metabolic condition. The practical dose, supported by clinical evidence, is 20 to 30 grams per day, equivalent to 2 to 3 squares. This is the portion at which studies have documented benefit without meaningful glycemic impact. Beyond this amount, the fat and residual sugar content can produce a delayed glucose response through the gluconeogenic conversion of excess dietary fat and protein. The label trap to avoid. Many products marketed as dark chocolate or 70% cacao still have sugar as their first or second ingredient. Read the ingredient list, not the front of the packaging. Cacao mass or cacao paste must appear as the first ingredient. If sugar appears before cacao in the ingredient list, the product does not genuinely have 70% cacao, regardless of what is printed on the front label. The second type is dark chocolate with 85% cacao or higher. This is not simply a more intense version of the first type. It represents a meaningful difference in both mechanism and evidence. At 85% cacao, the flavonoid concentration is substantially higher than at 70%. The sugar content drops to approximately 10 to 14 grams per 100 grams, compared to 20 to 25 grams at 70%. This means both a lower glycemic impact and a higher dose of protective compounds per serving. A peer-reviewed study evaluated the specific effects of chocolate with 83% cacao content in 60 non-smoking patients with type 2 diabetes and hypertension between 35 and 70 years of age. Participants consumed 25 grams of chocolate containing 450 milligrams of flavonoids daily for 8 weeks. The dark chocolate group showed improvement in lipid profile and significant reduction in inflammatory markers compared to the control group receiving white chocolate. Specifically, CRP, interleukin-6, and TNF-alpha, all primary mediators of the chronic low-grade inflammation that drives and perpetuates insulin resistance, were measurably reduced. 2 Swedish studies documented that increasing dark chocolate consumption by at least 50 grams per week reduced the risk of cerebral ischemia and hemorrhage by up to 27%. For a person with type 2 diabetes who already faces dramatically elevated cerebrovascular risk as a consequence of their metabolic condition, this additional vascular protection is not a peripheral finding. It is directly relevant to their most serious disease risks. The practical dose is 20 to 25 grams daily. The more intense and less sweet flavor profile of 85% chocolate naturally supports portion control because sensory satisfaction arrives more quickly per gram consumed. The third type is 100% cacao chocolate and cacao nibs. These represent the absolute limit of zero added sugar within the solid chocolate category. 100% cacao chocolate contains no added sugar, no added milk solids, no added fat beyond what is naturally present in the cacao bean. It is extremely bitter, with a flavor that requires adjustment over several days of exposure. From a glycemic standpoint, it is the safest possible form of solid chocolate. Virtually zero available carbohydrate, only cacao fat, fiber, and the maximum possible flavonoid concentration. Cacao nibs are fragments of roasted cacao bean before any further processing. They are crunchy, intensely bitter, and have even higher fiber and flavonoid content than processed chocolate because they have not undergone the refining steps that reduce some bioactive compound concentrations. They provide the most direct access to the protective compounds in cacao with essentially zero glycemic impact. In practice, 100% chocolate and cacao nibs work better as ingredients than as standalone eating experiences. A teaspoon of nibs added to plain yogurt or a smoothie, 10 grams of 100% chocolate melted and mixed with natural almond butter as a dessert. These applications deliver the full flavonoid benefit with glycemic impact approaching zero. The fourth type is sugar-free chocolate sweetened with erythritol or stevia. This type is specifically relevant for people with diabetes who prefer the flavor profile of conventional chocolate but need to minimize glycemic impact entirely. Erythritol is a sugar alcohol with a glycemic index of effectively zero. It has approximately 70% of sucrose's sweetening power, but is absorbed from the intestine through a different pathway and is excreted largely unchanged by the kidneys without producing meaningful blood glucose elevation or insulin stimulation at normal consumption amounts. When erythritol is used as the primary sweetener in chocolate, the result is a product with a flavor considerably closer to conventional chocolate than 85% or 100% cacao, with glycemic impact that is effectively negligible. Stevia-sweetened chocolate achieves a similar outcome through a different pathway as steviol glycosides are not metabolized by the body and produce no blood glucose response. The label trap specific to this category is critically important. Many products marketed as sugar-free chocolate use maltitol as their primary sweetener, rather than erythritol or stevia. Maltitol has a glycemic index of 52, substantially higher than erythritol, and meaningfully capable of raising blood sugar, particularly at larger portion sizes. Many sugar-free chocolate products in the United States use maltitol without prominently advertising this fact. Read the ingredient list specifically for the sweetener used. Erythritol and stevia are your targets. Maltitol is not a safe substitute for someone managing diabetes. The fifth type is pure, unsweetened cacao powder, and this is the one with the strongest clinical evidence, the highest flavonoid concentration per gram of any form in which cacao can be consumed, and the most direct documentation of improvement in HbA1c, the primary long-term blood sugar control marker in people with established type 2 diabetes. A systematic review conducted by researchers at the Fluminense Federal University in Brazil, published in 2021, analyzed 7 clinical studies examining the effects of cacao flavonoids on blood glucose and serum insulin in individuals with type 2 diabetes. The consolidated conclusion across those studies was that the use of dark chocolate or cacao powder at a dosage of 25 to 30 grams per day may demonstrate beneficial effects on blood glucose and glycated hemoglobin with additional cardioprotective benefits through increased HDL cholesterol. HbA1c is the marker that measures average blood sugar control over the preceding 3 months and is the primary indicator used to evaluate long-term diabetes management. Clinical evidence showing HbA1c improvement from a dietary intervention represents a meaningful and durable metabolic effect, not simply a transient blood sugar response. Why does cacao powder outperform solid dark chocolate in flavonoid concentration? Because in the process of manufacturing solid chocolate, cacao undergoes pressing, conching, and tempering steps that degrade some of the flavonoid content. Pure cacao powder, particularly natural processed, non-alkalized cacao, preserves a higher concentration of these compounds than any solid chocolate form. 1 tablespoon of pure cacao powder delivers more flavonoids than a full square of 70% dark chocolate with essentially no added fat and fewer calories. The practical applications are numerous. 1 to 2 tablespoons of pure unsweetened cacao powder mixed into unsweetened black coffee, stirred into plain full-fat yogurt with a small amount of stevia, blended into an unsweetened almond milk preparation warmed on the stove, added to a low-glycemic smoothie, incorporated into oatmeal, mixed into egg-based crepe batter for a chocolate flavor with negligible glycemic impact. The label trap for cacao powder is the simplest of all 5 types. The ingredient list should contain exactly 1 item: cacao powder or cocoa powder, nothing else. Avoid all hot chocolate mixes, drinking chocolate powders, and flavored cocoa products regardless of their marketing claims, including those labeled as reduced sugar or diet versions. These products invariably contain added sugar, modified starch, or other ingredients that compromise the glycemic profile entirely. Let me address something that belongs in every clinical conversation about food and diabetes, but rarely appears: the psychology of food guilt and its metabolic consequences. Research in nutritional psychology consistently shows that people who experience guilt after eating tend to consume more in the hours that follow, not less. The guilt triggers a compensation cycle of restriction and overeating that produces worse metabolic control over time than a planned, portion-controlled inclusion of the desired food would have. The diabetic who understands that 2 squares of 85% dark chocolate after a protein and fiber-rich dinner have a glycemic index of 22, delivers flavonoids that are actively improving their insulin sensitivity, and produces minimal impact on their blood sugar curve, has a completely different psychological relationship with that food than the diabetic who eats the same 2 squares while believing they are destroying their health. The knowledge changes the experience, and the experience changes the behavior. Plan the inclusion, control the portion, choose the right type. That combination is what sustainable, psychologically healthy blood sugar management actually looks like in daily practice over years and decades. Here's the complete summary. 70% dark chocolate, glycemic index of 0.22. Best entry point for flavor accessibility combined with genuine glycemic protection. 20 to 30 grams daily. Cacao must be the first ingredient on the label. 85% dark chocolate. Higher flavonoid concentration, lower sugar content, clinical evidence of reduced inflammatory markers including CRP, interleukin-6, and TNF-alpha in people with type 2 diabetes. 20 to 25 grams daily. 100% cacao and cacao nibs. 0 added sugar, maximum flavonoid concentration in solid form. Best used as an ingredient in small amounts to deliver. Glycemic impact approaching 0. Sugar-free chocolate with erythritol or stevia. Glycemic impact effectively 0. Read the label carefully and avoid maltitol, which has a glycemic index of 52 and is commonly hidden in products marketed as sugar-free. Pure, unsweetened cacao powder. Highest flavonoid concentration per gram of any cacao form. Systematic review evidence showing improvement in HbA1c in type 2 diabetes. 25 to 30 grams daily mixed into beverages and recipes. Ingredient list should contain only 1 item. Chocolate is not forbidden for the person managing diabetes. The wrong chocolate is, and now you know exactly which chocolate is right, in what amount, and what to look for on the label so that no marketing claim can mislead you. I am Dr. Kenji Sato. If this gave you knowledge that replaces guilt with clarity, subscribe and share this with someone with diabetes who believes they can never eat chocolate again. They deserve to know the truth. I will see you in the next one.